All right. You might have seen this. Let's switch gears. And as a prelude to our first guest, let me share this article. You might have seen this in the Providence Journal about 3 weeks ago. Leaders call for developing a biotech industry in Rhode Island. Here's what they propose. Well, we just happen to have a biotech expert who's joining us today. So let's welcome, I think for the first time, right, Bill? You and I have talked many times, but I don't think we've had you on the show before. Let's welcome Bill Smith to In the Dugout. Bill, how you doing?
Yeah, I would have remembered being on the show given your background. And
Okay. Now look, you are really playing the dugout game today. You got your New York Islanders stuff on.
yeah, I even have my name on the jersey because I grew up on Long Island. I want to reassure your listeners, I don't cheer against the Bruins. I know their AHL farm team is in Providence. My three kids grew up in Boston. They love the Bruins, but I grew up on Long Island. And so my high school was across the street from the Nassau Coliseum, and they were winning Stanley Cup after Stanley Cup in those days.
Yeah, that was the Gretzky days, right?
That was, yeah, it was the 78 through 81.
All right, now I'm going to put this cap back on because believe it or not, when I was a kid, I was a Montreal Canadiens fan.
I believe it.
All right, Bill, let's get to business here. So we talk, Speaker Shekarchi and others in this state are talking about throwing some money at a life sciences, biosciences, effort here. If they can do it in Worcester and they can do it in Boston, why can't they do it in Rhode Island? You are a senior fellow and director of life sciences at our sister think tank, a much bigger think tank at the Pioneer Institute in Massachusetts. Does Rhode Island have what it takes? We've got an article you wrote right there on the Ocean State Current. Let's show that to everybody. Go ahead, Bill, take it away.
Yeah. So first of all, I believe that the life sciences industry is one of the great American industries. We're ahead of China, way ahead of China. Europe used to be very prominent in the life sciences. They've faded because they have socialized healthcare systems. And the US produces more new drugs every year than any other country. So it's a great industry. It's high paying, it's technology jobs. So I'm sympathetic to the Rhode Island speakers. But
when we talk life sciences, Bill, what are we talking about?
Well, generally, there's no exact definition, but it generally means biotech, pharmaceuticals, and even medical devices would be included in those. And anything that kind of promotes human life would be fall into that category. And the temptation, I think, with some politicians, particularly in blue states, is to spend a lot of money, and then life sciences companies will appear. And I'm not sympathetic to that. I think at least in the Cambridge, Boston area, the life sciences cluster was created by the universities, MIT, Harvard, Tufts to some degree. There are great universities and medical schools in Boston, and the scientists. If you want a life science industry, you got to have life scientists, people they're expert in biology and chemistry, and you find those people in universities. So I think Rhode Island has something to be said for it in this. They have Brown University, which has an excellent medical school. And I think I mentioned in the article that the dean of Harvard's engineering school, Frank Doyle, my wife works at Harvard and worked with Frank and knows him and likes him a lot. It said he's really smart. He's the new provost at Brown, and he has a background in the life sciences. I mean, the first thing I would do if I were in Rhode Island is I'd go see Frank and say, what do you need to spin companies out of Brown University and Brown Medical School? What do you need?
All right, so let's just take it one step. So you're saying in your view, the first requirement is a strong university-based life sciences. We need academics, right, and experts, right?
Exactly.
All right, so that's the first step.
Talented.
And does Rhode Island have enough of that? Does Brown University have enough of that, or do we need more?
Well, Worcester did it largely with WPI, which is not a gigantic university, but they were the college in Worcester that helped build their life sciences sector. So I think Brown has the firepower and the endowment and the talent to do this. But there's going to have to be a focus on getting those academics that are doing great research to commercialize it, to get outside the university and start a company, hopefully in the Providence area or Newport or anywhere.
All right, so that's the cornerstone piece, right? Is the university stuff. I mean, what can the government do? I mean, they're talking about throwing money around. Where would they throw that money right now? They didn't say where they're going to spend it, but everybody just loves to throw money around and pretend like it's going to accomplish something.
Yeah, and I don't think you can do it in the life sciences unless you have the talent first. And what I would recommend is that you have a very modest government effort. So, for example, the Research Triangle Park in North Carolina became a technology hub because the state government created a small office, not a big bureaucracy, just a small office that helped companies that wanted to relocate to North Carolina. And you could do that in the Economic Development Agency within Rhode Island. An expert who knows about where the lab space is, what environmental rules affect these companies, and help them kind of as a kind of ombudsman to help the company land somewhere successfully. Cut through paperwork, give them ideas on lab space. There are things that state government can do, but government spending is not going to create a life sciences cluster.
And so in Massachusetts, you kind of hinted at this earlier, the politicians want to take credit, but the politicians might have done some things after the fact, but the politicians didn't create the industry in Massachusetts, right?
No, they did not. So, you have a Harvard biologist that's doing cutting edge research, and a venture capital firm hears about him, goes to him and says, I want to finance a company. And then off he goes. He leaves the university, becomes the CEO of a new biotech company. It's privately financed. He's got a great idea. He raises money. It does an IPO. Everybody gets wealthy, and you suddenly have a big biotech company. And there were companies that did that in the Massachusetts area. Again, it was mostly private money. The venture and the VC funds and private equity funds more than eclipse what the government could provide, and they do it more smartly. A VC firm that wants to invest in biotech, chances are they're going to have a Harvard-trained doctor on their board who's going to say, "Yeah, this type technology works. We should invest in it," or "No, I don't think that technology does work." So that the private sector can do this very smartly in a way that the government can't. And I know there are a lot of states out there that want to give seed grants to startup companies. I'm just skeptical about that. I just think the government can't be as smart about markets as private money can.
Yeah, one of the lines I liked, and I know you did it just for me, right, Bill? I would not make a Field of Dreams mistake just by thinking that you throw money at something to build a building or something that people will come. They need to be there already. You've already established that, but to have a life sciences industry, you need university-based academics, but you do need companies to invest in actual labs and things, right?
Yeah, you do. And but if these scientists are first rate, they're going to attract capital. They just are, and
growing demand for this. It's not like we're saturated in the industry or anything.
No, there's so many breakthroughs happening in the life sciences. It's extremely exciting. After we mapped the human genome years ago, that's starting to finally pay off, and we're starting to see all sorts of therapies that get to really the heart of the disease. And it's exciting for cancer and oncology research. It's exciting for a lot of rare diseases, like I think they're going to cure hemophilia, for example, in the near term.
Wow! Within
the next 5 years, sickle cell disease, a lot of terrible diseases that have been around for a long time have cures that are in the pipeline. So it's a very exciting industry.
One of the interesting points you make is, we've talked about Rhode Island's horrible business climate. We just can't attract businesses, A, because of that climate, B, because of the terrible schools that are here. Executives don't want to move here if there's bad schools. And C, what was C? I forget what C was, whatever. But we have a bad business climate. But in life sciences, that business climate isn't as important for some other low margin company to think about coming here, because it's a high margin industry, right?
Yeah, the profit margins in a biotech company might be 20%. So yeah, they're concerned about the business climate, but not as much as the guy trying to run a manufacturing business, that's
right,
trying to make payroll every couple of weeks and and little changes made by the government are going to really impact them. Biotech companies, pharma companies have enough capital that they don't worry about that as much.
I love the point. I'm calling it the Henry Ford point you made here. I think you know what I'm referring to, but I'll just tell your last word of the state should actually consider buying the products produced by the companies they seed. Henry, in the state, Henry Ford said, look, we're getting this assembly line, these Ford Model Ts or whatever they were done, but I'm going to require that every employee buy one. That helped create a little demand, helped create a little revenue and talk around the company. Same kind of thing you're talking about here.
Yeah. So, if you have politicians that are railing against biotech companies and their products, and look, the industry has a very unique business model, right? They have a patent on a drug for 20 years, but they may only get to sell that drug 7 or 8 years because they put patents on early in the R&D process. But then for those 7 years, they could charge a high price for that drug. Then the drug goes off patent and it goes generic, and then it's really cheap, pennies on the dollar sometimes. And that's the business model. That's just what it is. But politicians don't like that. When it's patent protected, they don't like those higher prices. And a lot of them in the state Medicaid programs won't even buy cutting edge drugs. They just refuse to buy them. And if you want to locate companies, life sciences companies here, you gotta say, okay, we appreciate what you're doing.
All right, so you kind of mentioned this earlier, but what I don't understand, what is the vitriol that politicians as you write at the end here, often level at life sciences? What is that? Where does that come from?
Well, it used to be the market has changed a little bit. It used to be that drug prices were very high and many new drugs were coming on. And in the 1950s, most people
basically the big pharma thing. That's the big pharma thing.
Yeah, exactly. And then the politicians would rail against the price, and they'd hope the voters, particularly senior citizens who vote in high numbers, would be sympathetic to their attacks on the pharma companies. I think the market has changed a lot. And what's happened now is that insurance companies are charging more out of pocket. It's not that drug prices are growing so fast. It's that people are paying a lot of money out of pocket. And so politicians can still get away with criticizing drug companies. In my view, currently, the problem people are having, it has to do with the insurance design, the benefit design of their health plans, where they have a $5,000 deductible and suddenly they get cancer and they got to pay $5,000 out of pocket. That's problematic to me.
I think it's a noble goal that Speaker Shekarchi and other leaders have here to try to bring that here, especially if we have a cornerstone in Brown University and potentially a growing life sciences academic staff there. You do mention, I don't want to get into it. You do, I'm just going to mention it and then go on to the point. You do mention that there was big government spending in the United Kingdom on this, but it failed because for decades they had driven out this kind of talent. Like you said, there was some vitriol, this big pharma kind of thing. And now those European life sciences have set up shop here in Massachusetts. So we don't want Rhode Island to make the same mistake. We don't want to throw good money after bad. So wrap things up. What is your advice to Speaker Joe Shekarchi? What, if anything, should our government be doing to encourage life sciences industry?
First thing I would do is I would go see the new provost at Brown University, who knows how to do academic industry partnerships and spin out companies. He did it at the engineering school at Harvard, and he could do it at Rhode Island, and he has a life sciences background. So the timing of this is almost perfect as far as the speaker is concerned. And I'd go see him first and say, what do you need? How can we help you spin companies out and locate them in Rhode Island? I would also talk to venture companies, and I'd bring the venture firms and private equity firms in, and I'd say, do you know about research going on at Brown University or other Rhode Island colleges? We want you to encourage those academics to start companies here in this area. So go after the private money first before you start spending public money.
Is that what you do up at the Pioneer? Do you try to you work with lawmakers and match them with private industry and colleges?
No, I'm not really an economic development guy. I concentrate more on policies that impact the life sciences cluster. So,
all right.
There's regulation on
marketing. You work with lawmakers all the time, right?
I do, and I get a lot of interest from all around the country. Texas and Florida have been trying to create life sciences clusters for years, and they just haven't had as much success. They're having some success in Texas. They have a couple good medical schools there, and cancer research is pretty prominent in Texas now. But they haven't been able to duplicate what's going on in Boston and Cambridge because they just don't have the universities.
Is San Francisco a hub of this as well?
It is because of Stanford. Yeah. So
Okay.
the two clusters of
Because of
life
Stanford,
sciences
right, got it.
companies
Yep.
are in blue states that don't have very good business environments.
Yeah, I gotcha.
Massachusetts and California. So
All right, if I can arrange it, would you come down here and meet with Speaker Shikarchi?
I'd be happy to, of course. I love
Bill?
Rhode Island.
Bill Smith, you're an Islanders guy. I love it. The New York Islanders, a Long Island guy. Thanks for joining us and having some fun and great expertise here on In the Dugout. Hey, maybe we'll have some news and we can have you help us out here in Rhode Island. Thank you, Bill.
My pleasure. Thanks, Mike.
All
Thanks
right,
for
Bill
having me.
Smith, thank you.